Hey beautiful people, welcome to my channel. My name is Busisiwe Dlamini Harudi, the Campeth Principal. So if you haven't subscribed to my channel already, may you please click on the subscription box there at the bottom and also click on the notification bell so that every time when I post a video, you'll be notified and be the first one to check it out. So today we are just going to do a quick one, which is the journey of a sample so that you understand where or how does it come about for us to have samples and run them in the laboratory. Or maybe sometimes you do wonder that you go to the doctor and then the doctor takes some sample and then voila, all of a sudden the doctor tells you to come back after a certain period of time and give you results, whether positive, negative, or they might have a value of some sort. So basically this is how this happens. So the first thing that usually happens, it starts with you as a patient. You will go to the doctor. So here, when you go to the doctor, you get there, you tell the doctor how you feel, what is going on with your body, which is very, very important. I can never stress this enough. It's very important because what you're going to tell the doctor is what's going to direct the doctor to request the correct test so that you can be able to get the correct diagnosis. I've had at some point in my life, you find that people will be like, yo, I don't like this doctor so and so and so because every time this doctor always misleads me, he always misses my diagnosis and so on. But sometimes it's not about the doctor. It's about you. What did you tell the doctor? So this information is information that you can even share with your family members so that we can make sure that we get the correct diagnosis as much as possible every time. So you get there, you tell the doctor everything. If you have traveled, you went to Durban, you just came back, you might think that information is not important, but it is important for the doctor, even for us, in giving a correct diagnosis at the end of the day. So the doctor will ask you a lot of questions, give answers to those questions, add whatever that you've eaten, whatever that you drank for the past 2 days or for the couple of days. That will be important information. So basically that's where it starts, which is number one. It's a patient with a doctor. You give your doctor a clinical information on what is going on with your body. Why are you not feeling well? What's wrong? And then after that, the doctor will request some tests. So based on what you told the doctor, if you said, you know what, doctor, I have this backache, every now and then, I feel pain here at my back. So what that is going to give the doctor will think, oh, maybe let me check, probably it might be the kidneys, because he knows that the kidneys are situated at the back, and then doctor might request a kidney function test. So that's when the doctor will request the test, like I said, based on what you told the doctor. And then you, after the doctor has requested the test, and now blood needs to be drawn. So the blood, or let me not say the blood because it can be any sample. We do also test urine and feces as well. So based on what you told the doctor, or based on the test, that the doctor has requested, then the phlebotomist or the nurse will know which sample must be collected from you and which tubes they must use or collect your blood in. Because all of these tubes that we use, like if I can give you an example of one, this is how they look like. We call them evacuator tubes. If it's urine, then it will determine whether the system must do a random, just get a random urine from you, or it must be a timed urine. So like I said, the test that the doctor has requested will determine which sample is going to be collected from you, which is number 3. So once the sample has been collected from you, then the drivers will come and collect those samples from the depot or the hospital, and then they will have to take them to the laboratory where they are going to be analyzed and tested. And as well, this step is also very important. Those drivers, they are very, very, very important in this cycle, because how they will transport those samples can also determine the results thereafter. It can either bring good results or it can jeopardize the results, whatever that they do in between. So the drivers will take the samples to the lab, and then when a sample gets to the laboratory, it will get into the pre-lab, which is a pre-analytical laboratory. So there, what they are going to do, they are going to receive the sample to say that we've received the sample in the lab. And usually there in the pre-analytical area, in some lab, you find that that is where as well the sample needs to be processed. So depending on what sample type it is, then it will depend on which processing is going to be done. So if it's blood, and then for that specific test you need plasma or serum, then it means that blood will be centrifuged so that we can separate the cells from the plasma or the cells from the serum. And then if it's urine, then it will need to be aliquoted and centrifuged as well. So basically that's what I mean by processing. So it will be processed. Then as soon as it has been processed, then now the sample is ready for analysis. So it will go to the technologists and technicians in the laboratory, and then what they will do, they will analyze the sample. If it needs to go into a machine, they will put it in a machine. If they have to do a manual test, they will analyze it manually, which then will give us step number 6. So once the sample has been analyzed, then now what do we get? We get the results of it. And then what the technologist will do now will verify the results and say, okay, these results, they are correct results based on all the quality control that I've done, all the calibrations and everything. And I'm confident that this result that I'm sending out is a good result. Then once the result has been verified, then the results will be printed, which will be step number 8. And then after the results have been printed, now they will be taken back into your doctor. So then that's when your doctor will either call you or send you an SMS, whatever means of communication that your doctor uses, to tell you that may you please either come to the surgery so that you can discuss your results, or maybe some doctors can give you results telephonically. So basically, this is how the journey of a sample is. But always remember, it starts with, what do you tell the doctor? So make sure you tell the doctor as much information as possible, even if you might think it's unnecessary. It is necessary. Thank you. That's it from me for today. Bye. Okay.